Say good morning to the independent member of the House of Assembly, elected by the folks in Mount Pearl Southlands. Yeah. Paul Lane. Paul, you're on the air.
Good morning, Paddy, and how are you this morning?
Best kind today. How about you?
I'm great, Paddy. Paddy, I just wanted to put out a bit of information that was, I guess, a little bit, I was a little surprised and I'm a little concerned about. Given all of the issues that we've heard in the media recently around, mental health and people, saying that they're not getting the services they require or being turned away without getting the services they require and all those things. There was some conversation that's been going on for a while about that, and I had a couple of people raise an issue with me around the crisis line that somebody can call.
Yeah.
They had told me that, that they or I guess friends or acquaintances or family members of them have had occasion to call and could not get any kind of a response, which I found a bit odd. So I did a little bit of research into the crisis line to find out exactly how it works and so on. So I have a bit of information I just want to share with
Let's
you.
do it. Go ahead.
So first of all, the crisis line is operated by Eastern Health. However, it services the entire province of Newfoundland and Labrador. The line is staffed 24/7. However, there is only one person staffing that line at any given time. Now, and they operate with a 12-hour shift system, 8 a.m. to 8 p.m., 8 p.m. to 8 a.m.
And just one person per shift?
One person per shift. Now, in the St. John's metro area, they also have what's known as a crisis team. So that would be two individuals, and they spend 99% of their time on the road responding to issues, like physically responding. So if if the police or the authorities are dealing with somebody or somebody, has some kind of a crisis, they would actually go to that location where that person is to, whether it be their home or shelter or wherever it is, and deal with it one-on-one. So there could be occasions from time to time where if they happen to pop into the office and the phone rang and the person was on the line, they could pick up the phone. But that very rarely happens. So 99% of the time, there's just one person there to answer the phone. And that crisis team, by the way, is in the St. John's metro area only. They go as far as Holyrood. There is no crisis team operating outside of the Holyrood area. So there's just one person to answer the phone. If somebody calls and that person is on the line, like with somebody else, I've been told that they will not hang up, or put that person they're talking to on hold to pick up the other calls. You simply won't get through. And if you do call in, what you'll get is an answering machine, and the answering machine will basically say that our counselor is on the line talking to somebody else. Please call back later. They can't leave a message. There's no one to, intercept that call. Nothing. They're just told, call back later, we're busy, basically.
Yeah, well, not much of a way to handle someone in crisis who probably has struggled with even wanting to pick up the phone and make that call for a variety of reasons. And then when it's leave a message, just think of the frustration we all have when we call our bank or an insurance company or something, and all you want is to talk to a real person, and you get a machine, and how frustrating that is. Imagine being in a mental health crisis and no answer or simply leave a message.
You could potentially, be suicidal or whatever the case might be, and you get an answering machine say, call back later. We're busy. So, and I understand, Paddy, if there was two people answering the phone, then the argument could be made, well, what about if a third person called? There was three people answering the phone, what if a fourth person
called? That's how I was going to do it.
We can always make that up. We can always make that argument, but I just think that having one person and one person only there, given the volume of calls, which I understand that it's quite a busy spot to say the least, I think it's really something that needs to be looked into. Now, I did try to research like other provinces, and there are provinces that are much staffed much better in terms, like Ontario, BC, and so on. They literally have hundreds of call takers. PEI doesn't even have a crisis line at all, so they're even worse. They don't even have a crisis line. Some provinces utilize volunteers, and some don't utilize volunteers to supplement their operations. But that's what we have. So I just wanted to put it out there. That's what we have for our crisis line, one person, and it is concerning to me. So I will certainly be writing the Minister of Health and Community Services about it, and I guess perhaps the All-Party Committee on Mental Health, if they're not already aware. I would hope they are aware, but if they're not, I'll certainly be bringing it to their attention as well, because given, the serious incidents which have happened and the stories we've heard, given all the issues that we have around mental illness and lack of services and facilities and programs and so on, at the very least, we need to ensure that we have an adequate system to at least deal with the emergencies at hand.
Well, because, and I didn't know these things, but it's important to bring out because we are asking people to call this crisis line.
We are, yeah.
Because it's the pediatric care line. I don't know exactly what they call it, but if you're home with a baby and you've got some concern, the baby has a fever and you start to get worried. When our boys were small, I called that line a couple times and bang, every single time got through. So I don't know if it's a different staffing requirement.
That's the Janeway, I think.
It is the Janeways. There's a nurse on the other end.
Yep.
And then there's other, like the, what's the number we're asking people to call when your pee smells? What's that one now? The 811 or 811, the new line? The new healthcare line?
Oh, yes, the healthcare line. Yeah, I think that was, I think it might be 811. That was one that was introduced by the former administration, I think.
Absolutely right. Yeah. And I've heard people have had great success with that one, too, so I'm surprised that the trio, the one that would have the most potential problems is the mental health line. I'm glad you brought it up this morning. I'll see what I can find out.
Yeah, I appreciate that, Paddy. And like I said, we can't, if we're going to have these conversations and the frank conversations which do need to be had, then it's important that we get the facts out there. And like I said, we all understand that we're in a tight spot financially, and we understand the impacts that could have on things like proceeding with the Waterford Hospital and things like introducing all the programs we need. But surely, God, when it comes to an emergency service, and I would put that right up there with the highest of emergencies, and we need to make sure that we have that at the very least properly resourced.
I agree, and I've just been told, and this is by a mother of a young child, so she'd know. It's been a long time since I called the pediatric line. It's been discontinued. It redirects you automatically to 811.
Okay.
So fair enough, but I appreciate the conversation this morning, Paul. Thank you.
Thank you, Paddy. Have a good day.